There's a lot of nonsense talked about varicose veins, and I'm going to bust the commonest 5 myths about varicose veins. The first myth I'd like to talk about is that pregnancy causes varicose veins. Well, this is a commonly held view and it's simply wrong. Although varicose veins may appear for the first time in pregnancy, pregnancy doesn't actually cause varicose veins. If you have a predisposition, then they will appear for the first time. But if pregnancy really caused varicose veins, then only pregnant women will have developed them. And we see lots of varicose veins in women who've never had any children. We also see varicose veins in men, and the latest research suggests that varicose veins occur almost as frequently in men as in women, and clearly this wouldn't be the case if pregnancy was the main cause of varicose veins. The second myth about varicose veins is that it's something you've done. Crossing your legs, wearing high heels, perhaps being overweight, or not taking enough exercise. Well, again, this is simply wrong. It's not your fault. These are not causes of varicose veins, and there's very little you can do either to cause them or really to prevent them. Well, the underlying problem that causes varicose veins is a problem with the valves, which leads to superficial vein reflux. We now know that superficial vein reflux is the major cause of leg ulcers. And varicose veins and superficial venous reflux are complicated by inflammation, varicose eczema, and varicose veins are also a major risk factor for deep vein thrombosis. The fourth myth I'd like to address is that you need a general anaesthetic to get rid of veins. Some specialists think that you can't do a thorough job, you can't do a thorough procedure unless you take the patient into a hospital operating theatre and give them a general anaesthetic. Well, this is simply wrong. We now know that procedures that have been designed specifically to be performed under local anaesthetic give better results, a lower risk of recurrence, that's the veins coming back in the future, and a much quicker return to normal activity. The last myth I'd like to address is you shouldn't have your veins treated, they'll simply come back. Well, that is a commonly held myth which came about because traditional surgery, surgical stripping, had a bad reputation. In many cases, veins did come back after surgical stripping, and the main reason for this is that the veins tend to regrow, a process called neovascularisation. We also know that after old-fashioned operations such as stripping, many people simply had the wrong operation. Well, nowadays these procedures are guided by ultrasound, so people get the right procedure, and modern treatments which are performed inside the vein, so-called endovenous treatments, don't initiate, don't excite or induce this process of neovascularisation. With modern treatments, the recurrence risk is very low and veins do not come back usually. So those are the 5 myths I've exploded. If you've been told one of these, or you have been told something else that you think might be a myth, do please get in contact with me, and don't forget to subscribe to the channel.